Welcome back. For many people, this year brings a lot of hope in the fight against the pandemic. With 2 vaccines, Pfizer-BioNTech and Moderna, approved by Health Canada, public health officials are hoping to vaccinate every Canadian who chooses by the end of September. So far, more than 100,000 people, mostly healthcare workers and long-term care residents, have been given at least 1 dose of either vaccine. But there's concern over what some are calling a slow rollout that included some vaccine clinics closing for the holidays, as Ontario and Quebec both saw record case numbers in recent days. Pressure on ICUs is mounting, and there's worry over just how widespread that UK variant might be. So what will 2021 look like with vaccines, variants, and restrictions? I'm joined now by infectious disease specialist Dr. Zane Chagla in Mississauga, Ontario, and Dr. Lenora Saxinger in Edmonton. And Dr. Chagla, I want to start with you because I'm trying to figure out what's happening, particularly in southern Ontario, where there has been some degree of lockdown now for at least a couple of weeks, and yet case numbers are still so high. What's going on?
Yeah, so, I mean, the Toronto area has been in a semi-state of lockdown for almost a month and a half now, and the rest of Ontario did go into a full lockdown as of the 26th. There is some growth in those regions outside of Toronto, which may eventually succumb to the lockdown and growth come down in the next few days. But it does bring up the greater discussion of the people that do need to go to work, even in this lockdown state, are still being infected in the Greater Toronto area. And again, personal gatherings are still being implicated in the Greater Toronto area, which is unfortunately something a lockdown is not able to prevent.
And so what do you think the lessons are here for what needs to be done?
Yeah, I mean, I think, number one is supporting those people that have to work despite the restrictions in place, making sure they have access to testing, making sure they have access to financial supports to support isolation and not to work while having symptoms. And, I think still there's work to public messaging to making sure people stay at home, limit their gatherings. As much as we've hammered this home, I think it still needs to be implicated going forward, knowing that there's still ongoing transmission, and this is still a big point.
Dr. Saxinger, I was speaking with you early in December, and at that point, case numbers in your province were soaring, and there was a lot of worry about what might be happening in hospitals around Christmas time. What ended up happening?
Well, we actually saw continued increases in hospitalization and ICU numbers, really from our case peak in the first half of December. And we're just probably seeing the peak now. It might be starting to plateau. So we have, between 900 and 1,000 people in hospital, around 150 in ICU. For our population, that's a lot. That's like 2 or 3 extra hospitals and maybe 10 extra ICUs of COVID patients in our system right now. And so the system is coping well. I actually think our acute care services are doing an admirable job, but it's definitely stretched. It's definitely very difficult.
And what's the mood like? What's it like inside the hospitals in Alberta?
I think if we hadn't had news that vaccine rollout was starting, I think the mood would be a lot darker. But because that kind of gives us a way to see the way out, people are coping reasonably well, but there certainly are some people who are getting a lot of extra work right now, and it's a stress. It's definitely a stress on the system.
Dr. Saxinger, was exactly 2 weeks ago we learned about this UK variant, which appears to be much more contagious. What's the latest that we know about it now?
Well, for the UK variant, right now, a lot of labs are tooling up to try to be able to do higher numbers of samples for screening for that. And we're just trying to get a handle on whether or not we think this is contributing to the current surges across the country. And so far, it doesn't look like it's clear, honestly. But it is an alarming variant because it could actually stand to make it much harder to control the virus during the vaccine rollout phase. And by that, I mean we have to do better at the basics to be able to keep this from taking off on us again.
Dr. Chagla, you and your colleagues have been very good about pointing out that viruses do mutate, so that shouldn't come as a surprise. But how concerned do you think we should be about this UK variant?
Yeah, I mean, it's shown the ability to transmit, and I think we were seeing that obviously in the UK. There's some emerging evidence out of Denmark where it's shown up and is rapidly starting to replace. And so as Dr. Saxinger had mentioned, the buffer that we have with some of our public health interventions gets much smaller when this variant starts circulating. our ability to, function as a society, keep schools open, keep essential workplaces open, particularly during this massive vaccine rollout, really does balance against this variant transmitting. So it's going to be very important that these measures stay in place, that people still minimize their gatherings and really report when sick. And it's going to be especially important for the vaccine campaign to roll out to decrease the burden in our communities altogether of this variant and whatever other variants are out there.
And Dr. Chagla, speaking of the vaccine, health officials in the UK have changed the dosing requirements for 2 vaccines, allowing the second one to be administered up to 3 months after the first. And I guess the attempt here is to achieve broader immunity. What's your view of that strategy?
Yeah, I mean, there's evidence from other vaccinations where you can delay the booster a few weeks, even a few months. And so, I think they're rolling this into the concept. There is some scientific data around this in other cases. There's nothing in the vaccine monographs that allows this, but I think you're taking the effect of, again, getting that buffer for logistical reasons to get more vaccine out. So it's an interesting approach. I think they'll generate data. I really do hope that they study people kind of right before they get that second dose to make sure their antibody responses are still optimal. But certainly all of us will be able to learn from this moving forward at the optimal strategy. And there is some scientific validity to this, making sure that people get the second dose, but stretching out that second dose a little bit more.
And Dr. Saxinger, the first Monday of 2021 is coming up for a lot of people. That really is the kickoff to the new year. What are you looking for in the coming weeks?
Well, I think that we've learned so much about this virus, and we are in a much better position than I could have imagined having a vaccine that we can start to roll out. We have a couple of curveballs with the current surges and with hospital capacity. But I think I see the way forward as being applying what we've learned very, very well and getting the vaccine out as quickly as we can. And I do think that we will have a much better looking summer.
Dr. Chagla, you spent 2 hours with us on the radio this afternoon, something Dr. Saxinger has done as well. As you know, I appreciate the time from both of you. Thank you very much.
Thank you.
No problem.